Hi, my name is Adan, and today I'll be talking about hip flexor range of motions assessments. So we'll be talking about the modified Thomas test, which assesses for the iliopsoas and the rectus femoris. It assesses hip flexor stability and indicates potential dysfunction related to low back pain, hip and knee pain. Uh, it also is significance is a common orthopedic assessment, identifies potential limitations, reliability is pretty high, has public stability consideration, and a pass or fail for validity. So to perform the iliopsoas modified Thomas test, you first want to start off the participant in a supine position, and then make sure the pelvis is stable or neutralized, and then from there on you will indicate them to flex their hips and their knees at the same time. As you see, I'll make sure they have a neutral pelvis. Then I'll go ahead and stabilize one of the legs and have the other one that's open to extend the knee, and then from there on just drop the leg slowly all the way down as far as you can. And as you'll see right there, we're in this assessment, we're looking for a pass or fail score. So we're looking for that the femur is below the hip. That will be the pass. If it's aligned or just restricted at the right above the table, uh, that would be a fail in this examination. And then for the rectus femoris, same thing, supine position upon a table. You'll flex the hip, the knees. Then we'll again look for a neutral pelvis. I'll stabilize it on the legs. And then in this one, we'll have the knee flex all the way out and dropping it below the table as far as you can. And here, the path to fail score is the same thing. Knee or femur has to be below the horizontal line or with the hip joint. In some protocols, the passive fail score is you can use a goniometer measure where the knee is aligned with the hip joint, or in some cases you can have the knee flex at 90 degrees. If they're able to reach it, that's a pass. If they can't, it's a fail. So in his case, he's within normal ranges. Since we're using the goniometer, or I use an online goniometer app, uh, it's supposed to be 15 degrees below the horizontal or below the hip joint. So as you see on the iliopsoas, he's able to get 14 degrees, and the rectus femoris, he's able to get 13. And so indicating he's within normal ranges. So potential limitations that we've seen is pelvic tilt issues. He has decreased activation of the glute medius, which that could be implications for functional movement, increased strain potential, increased injury under load, and impact gait efficiency. And that can impact sports because it will reduce range of motion, increase risk of injury, compensatory movements and efficiency, impact on agility and speed, and specific athletic movements such as running, kicking, or jumping, or deep squats can be impacted. Although he has a normal range of motion as a general population, may be insufficient for extreme sports. So athletes like gymnasts or dancers might require greater hip and flexibility than average. Even in a normal range, it can limit their ability to perform advanced skills needing exceptional range of motion. So many tests, like the modified Thomas test, they assess static ability, flexibility, range of motion in a stationary position. However, the athletic movements are dynamic, requiring flexibility for motion, often under load. An athlete may have normal static hamstring length, but the dynamic control and flexibility necessary for high-speed running or kicking, risking injury or reducing efficiency. And in his analysis, he does have some bilateral asymmetries. So those small asymmetries may affect specific movements, needing balance, power, and coordination. For instance, light hamstring flexibility difference in a sprinter may alter stride length, running mechanics, and raise the risk of injury in a less flexible leg. So in summary, a normal score on a flexibility assessment doesn't ensure optimal muscle extensibility for sports. So the athlete may face limitations in dynamic flexibility, neuromuscular control, stability, asymmetries, and sport specific demand.